Hi, my name is Jim Rose. I'm a licensed clinical professional counselor in the great state of Maryland. And the question for today is, what's the connection between trauma and addiction? Trauma and addiction, addiction and trauma, they often go together. What's the connection? Simple. A lot of time, people become addicted because their substance of choice, drugs, alcohol, whatever, helps them manage overwhelming feelings. And where do those overwhelming feelings come from? Trauma. Yep. People get traumatized, they're overwhelmed by their painful emotions, and they find a substance that helps them keep all that crap under control. It doesn't solve the problem, it doesn't make the problem go away, but it gives them a little bit of relief for a little while. And if that's all you can get, then they'll take it. And you know what? I can't blame them. That trauma stuff is painful. And who wants to go around living in chronic pain? Not me. So I don't really blame them. I didn't really get the meaning of addiction for people until actually I had my first client as an intern. And this big guy comes to my door and he says, I'll give you 5 minutes, 10 minutes tops. I don't believe in this therapy stuff. And so, started talking. I said, so how come you shoot heroin? Guy's been using heroin for many, many years. He said to me, because if I didn't, I'd commit suicide. And I had to think about that. See, for him, heroin wasn't a bad thing. It was a troubling thing, no question. But it was heroin that was keeping him alive. So then the question became, well, why did he want to commit suicide? Turns out he had very serious trauma from the time he was a kid, and no one had ever spotted it or named it for what it was. Heroin helped him deal with the overwhelming pain of his early childhood trauma. So, from his perspective, it was a good thing. It kept him alive. Most people who use to numb out painful emotions. They're not always traumatic feelings. But in my experience, and I've been doing this for about 5 years now, trauma is often underlying it. And it's trauma that leads them to chronically having these painful emotions. Now, when people start to recover, it's really got to be a two-step thing. First of all, they need to get over the physical demands of the drugs. People have told me some pretty horrendous stories about going through withdrawal, especially heroin withdrawal. They will puke. They will shit themselves. They will piss all over the place. They will be unable to eat. They will feel so sick that they feel like they want to die. That's if they're going cold turkey. And they would rather shoot up again, even if their brain is telling them it's not a good idea, than have to go through this real painful, painful sickness. So people have to get over the physical pain of their addiction before they're ready to move on and deal with the emotional pain that was probably underlying the addiction in the first place. You see, all of us have what I call a window of tolerance. There's a range of emotions that we can tolerate, and then there are certain emotions that we can't. For a traumatized person and an addicted person, go figure, The window of tolerance is pretty narrow. It might be kind of like this. And I call these the fuck it walls. Why? Because this is what the addicts tell me. You hit any one of these walls, and their first response is, fuck it, I might as well go get high. So these are the fuck it walls, and this is the window of tolerance. For an addict, the range of emotions that they can tolerate is pretty darn narrow. That also gives us a nice definition of recovery. Recovery is a matter of expanding the window of tolerance. So gradually, often with therapy, over time, people find they can tolerate more and more and more of their emotions before they hit any one of these walls and they feel like, I have to go get high again. And usually they'll get to a point where they'll hit those emotions, and if their recovery is working, they'll be able to rely on other resources. They will have learned other skills for coping with very, very painful emotions. So one of the things that we have to bear in mind is that recovery is a long-term process. It's not a quick fix. There's no quick fix. And one of the things that all people in recovery have to deal with is they have to adjust to a new normal. Not unusual for people to have been in addiction for 5, 10, 15, 20 years. And they get to a point where the using life has become normal for them. I mean, I've even talked to people where their parents used. For them, using is perfectly normal. I've had guys tell me their dad shot them up when they were 13. For crying out loud, if that's your normal, how do you adjust to what the rest of us might consider a normal, non-addictive life? Normal is whatever you grow up with. And if what you grow up with is crazy, then you've got to hit a serious wall before you go, well, this ain't working anymore. I've got to find a new normal. Now, recovery rates, frankly, are pretty damn low. About 5% of the people who go into recovery last more than a year before relapsing. That's not a great success rate. In any other medical field, they'd be thrown out the door, going like, this shit ain't working. Why? It's just the way it is. I think that the reason so many people get into recovery and relapse is because underlying the addiction is the trauma. And until we have spotted the trauma within them and help them find relief for the trauma, the painful emotions will return. And when the painful emotions return, the desire to use will return right along with it. So I'm going to have more to say about this in future videos. But right now I'm just asking you to get the idea that there is a deep intrinsic connection between trauma and addiction, and that for most people to break free from their addiction, their trauma needs to be identified and dealt with. There is hope. It can be done.